and I will start recording right now.
Vegas,
Mary,
can you pan
Melissa,
your
I
camera
did.
down?
Thank you, Melissa. Oh,
I'm
I
sorry.
can actually. Yes.
Vegas, this
I
is
can.
Abby. Can you pan your camera down? We can't see everybody. We can see the ceiling. There we go. Keep going. There you go. Now we can see you.
Wrong way. There it is.
Thank you.
Okay.
Mary, does it roll call?
Yeah. Oh, yeah, we do have, yes, we have quorum and everybody should be putting their information down. Okay, we should be good.
So we're good. Hi, everyone. So welcome, everyone. My name is Jenna Ward. For those of you who don't know me, I'm the current chair of the ICC. So I'll call the meeting to order at 8:38. Thanks, everyone, for coming today. There's a lot of things going on, so I appreciate your time and your energy to this. You'll also just notice that we have a brief quarterly meeting this morning to get through some reporting and information, and then we will switch over to a strategic planning meeting at 10 a.m. So just to know, if you are used to our longer quarterly meetings, that's why it's a little bit different today. We'll do mostly just kind of reporting out, and then we can get into other things that we have to discuss about the Part C system during our strategic planning. So thanks, everyone. We are working on maybe a Wi-Fi option for people who are not state employees or this type of state employees that get Wi-Fi access here. So we're working on it if you're in the building. I just want to thank everyone, and really, especially today, you know, there's a lot of things that maybe your heart is thinking about today. So I just want to take just a moment for us to breathe and think and set an intention for our meeting today, for our quarterly meeting today, for the next hour and a half to really attend to our business today. So just take a moment, take a breath. Think about being together today and what we're going to focus on for the next hour and a half. Come back. Are we ready? Yeah. Answer it. Yeah. Okay, we're going to start with public comment number 1. I'm going to start actually with the people online. Is there anyone online that has public comment this morning? Okay, hearing none online, is there any public comment in the room? Yes, Catherine.
I have just a brief public comment. My name is Catherine Nielsen. I am an ICC member, but I also serve obviously multiple capacities. So the executive director of the Developmental Disabilities Council. We have 3 town halls that'll be taking place in Southern Nevada next week. On the 16th, we will be in Pahrump. On the 17th, we will be in Mesquite. And then on the 18th, we will be in Las Vegas. You can find information on that on our website, on addresses and such. They're all held from 5:30 to 7:30. We do provide a little bit of food so people don't get hungry while they're there. But we really want to hear from the community on what services are working, what's not working, and what we can do to help make them work. It is for our next 5-year state plan. Thank you.
And those are all in person?
Yes. We do have virtual ones coming up as well, but all the dates are on our website.
Great, thank you. Other public comment from the room? Okay, great. We're going to go on to our next item, which is the approval of minutes. I'm going to say, just for this item, we already approved the December minutes or the January minutes, so. But I will entertain a motion for the December 6th minutes, which were part of the packet. Was everyone able to access the full packet?
On the website.
Yes, no, it is on. Yeah, it's.
I'll show
You want to show them? It's available on the website.
So this is Mary Garrison for the record. All of the ICC materials are now located on the 2024 public meetings for the Interagency Coordinating Council. This was the link that I emailed as well. And every meeting should have an agenda section, a minutes section for when minutes are approved, and then attachments. And so if you select the attachments option, you should see the entire packet on here. Previously, before I had everything for the packet, I actually attached the minutes to the meetings that we were going to look at. And it is my fault about the December meeting and January meeting being listed. We were actually approving April, and I missed that. So they were under the minutes section previously, but once the entire packet was available, they are all in this section here under attachments. So once they are approved, they will go into the section for the minutes for that meeting. And every meeting that has minutes will end up with a video of the recording of that meeting as well. So you will have verbatim what was said and discussed. The minutes that will be going forward are an overview of decisions that are made, topics discussed, and then if you wanted to listen to the whole thing, you would have the recording as well. Any questions about that? I hope this makes it easier to review minutes, because verbatim is a little dry at times. So
Well, that's more like seconds.
exactly, like literally seconds. And so that's how we used to do it when we didn't have the option to have like these links and stuff. I talked with our information officer, public information officer, and he's like, this is how we do it in our area. This is how you guys can do it going forward. And I'm like, I love it. So if there is any concern about us doing it that way, please let me know. And I will adjust.
We can talk about it.
Yeah.
Thanks for walking us through that, Mary.
Yeah.
I know that's a new way to look at the packet in the minute, so I appreciate
Yes.
that.
And I do want to say I could not attach the packet to the invite.
Well, it's like 500 pages.
It's only 500 pages, so that was not an option. So this works.
Okay, thanks, Mary. So the minutes are available. That is just how Mary showed us. So we are, because it's on the agenda, and we apologize for the agenda, we will only approve the December 6th minutes today. We'll approve the April minutes at our next meeting because they were on the agenda. So now I'll entertain a motion to approve the December 6th, 2023 minutes.
This is Catherine. I'll make a motion.
Thank you. Is there a second?
Julie Dale.
Thanks, Julie. Any discussion? Anyone online discussion? Just want to double check. No? Okay, hearing none, I'll call the vote. Anyone opposed to approving, to the motion to approve the minutes? Anyone abstaining? Motion passes. Thanks, everyone. Mary, good?
We're good. I'm just checking the chat to make sure we don't have anything in there.
Great.
We're good.
Okay, next item on the agenda, I'm going to turn it over to Sarah for our aging and disability services update. So I'll turn it over to Sarah for a quick data system update.
Good morning. This is Sarah Horseman for the record. And for purposes of strategic planning, I do have a delayed flight, so I will be there late. I don't know if there's a virtual option for part of it, but I'll message Mary separately. But I wanted to say that since it was business related. So for our early intervention data system, we have made some progress. We still have a lot of regular meetings with the vendor to make production updates and system design updates to better meet our needs. However, we have been making headway with meeting our NRS and NAC required state reporting based on the information we have in the data system and still being able to utilize our legacy system of track. We have mitigated a lot of the billing issues that we were experiencing specifically for the community providers, a lot of which we have resolved a lot of those issues. And now it's mainly on the program side and data entry, which we work with the community providers once a month still to make sure they know the processes. We just had a open office hours yesterday afternoon where we walked through the data cleanup and processes. And I think that's all the updates we have for right now. I know Melissa will be sharing more data later. Are there any questions from the council regarding our data system and case management system? Okay, I will turn it over to Stephen Pawlowski for the system analysis results.
Hey, Sarah. Stephen, are you?
Good morning. As Sarah said, I'm Stephen Pawlowski with the Burns & Associates Division of Health Management Associates. We were the contractor that worked with Part C and ADSD to conduct a comprehensive system evaluation. I'm actually going to turn it over to one of my colleagues, Rique Barber, who is our lead consultant on this engagement, to give you the highlights of a rather lengthy report.
Thank you, Stephen. I was actually going to ask, would it be all right if I share the report on my screen, or do we need to navigate from the agenda?
Absolutely. You're welcome to.
Okay. Might just be a little bit easier. This is the same report that's embedded into the agenda. It's what's taking up most of the agenda's space at 270 pages, but we will not have time to go through the entirety of the report today. So I'm just planning to highlight how the report is structured, so you have an opportunity to just get an understanding of what's in the report, and then later read the report when you have an opportunity. So let me just go ahead and share screen. Stephen mentioned, my name is Rique Barber. I'm a consultant. I worked with Stephen on this evaluation along with members from the IDEA Part C office, ADSD, the ICC, and multiple other system stakeholders like community partners and families that have currently or previously used services. We also interviewed Part C coordinators in other states to get an understanding of how their systems are structured, just to give us more criteria to evaluate the system against. We last met with the ICC in January, and we shared kind of a detailed accounting of our findings at that point in time. Most of those findings were draft, and most of those findings kind of made it into the report. We did make some adjustments following that meeting with additional data, additional conversation with stakeholders in the system, and we finalized the report, issued it on June 7th, as you'll see here on the report date. So I'm just going to use the table of contents here as kind of a means of outlining the report, what's in the report. Our report introduction kind of provides an overview of the services that are required to be delivered under IDA Part C. I'm going to jump to just a few key pages in the report as I talk through my points here. The introduction provides some demographic data that we extract from the American Community Survey, which is published by the Census Bureau. And this is data specific to Nevada. So for example, we discussed the total population and the population of children under 3 just to quantify the potential service population, those with disabilities that may be eligible for services. We provide an overview of the regional service delivery system in Nevada, the 3 primary regions that you see here in the map. And we discussed some of the challenges that Nevada faces in its geography, being primarily a rural and frontier state, with most of these counties being kind of in outlying areas and harder to reach areas, and then highly centralized urbanized areas in Las Vegas and in the northwestern parts of the state in Reno and Carson City. We conclude the introduction with an overview of our evaluation goals and some of the data sources we used. And just for the purpose of this conversation, I thought I'd just really quickly re-articulate what some of those goals were as we get into the main sections of the report. So in brief, our goals were to document the governance and administrative structure of NEIS, then to assess the effectiveness of these structures in supporting service access and quality. Also to evaluate differences in service costs between EIS programs, those being programs facilitated to deliver services by ADSD or by community partners. And then to measure and benchmark NEIS policies and system performance indicators to national data and other policies to provide context for how NEIS performs or how it sort of looks against other systems across the country. And the final section assesses other access-related indicators across the EI lifecycle from the time of referral through the time of transition out of the system. So back here to the table of contents, you'll see in the table of contents that there are three primary parts of the report. So in part one, we provide the overview of NEIS. In part two, we discuss workforce recruitment and retention, specific to 4 key or core disciplines. And then in part three is where we kind of discuss service outcomes along that EI life cycle from referral through transition. So I'll dive a little bit more deeply into some of these sections here. So as I mentioned, part one, we're opening here with the more detailed description of the minimum requirements of all EI systems across the country. Those are federally regulated or come from federal regulations that govern the IDEA Part C grant and the use of that grant. Then we describe in more detail the various roles and responsibilities of the DHHS partnerships that govern the systems. That includes the IDEA Part C office. So here we kind of inventory their major roles and responsibilities in governing the system, supervising the system, and providing administrative support to the system, and as well as ADSD's various teams and their responsibilities in governing the system. We did research on other systems across the country, 7 in particular, that we also tried to get interviews with their Part C coordinators to get a better understanding of how their systems are structured, any nuances to the systems that we thought might be helpful to point out in the report here, because one of our key findings are that although the federal regulations are there to govern what is done in the system in EI systems, they provide pretty broad latitude in how systems are designed and structured, and so that kind of comes out in these descriptions of other states and how they administer their system and how they structure their system, and it gives you some additional ideas of how, if any changes are needed in Nevada, how you might look to other states for ideas on how to structure things. We then describe the EIS programs that operate in the state, those that are facilitated by ADSD, and those that are facilitated by community partners in the different regions of the state. The next part of this section, part one, we begin discussing how Nevada is funded, or how NEIS is funded, the various funding sources. And like all other states, early intervention in Nevada is funded primarily by state general funds. And so we discussed that. We also discussed, some opportunities to potentially do more to leverage Medicaid funds that other states do, and to look to other revenue sources, such as the adoption of a family cost participation policy that not all other states do that, but multiple other states do that as a means of generating additional revenue for reasons that may become more clear later, primarily just an increase in service demands over the years, and in particular in the last year that we looked at, which is kind of a record referral volume. That was state fiscal year 2023. I would only be guessing about state fiscal year 2024, but the trend was just pointing upward on service demands in Nevada. So this might help to bring in additional revenue to help to offset some of those additional costs. Each of our sections conclude with something like an executive summary. So we call them conclusions and recommendations. So part 1, 2, and 3 each have a section like this. So if you're pressed for time, you might jump to these sections and read through them. We provide just an overview of our key findings and the recommendations related to each of those key findings. And I will point out that each of our findings are predicated on criteria. And so we look at federal regulations primarily. We look at best practices across the country and primarily those that are kind of promulgated by entities like the ECTA Center. And so we look for criteria to assess against, and none of this comes just from our own imaginations. Everything's rooted in criteria. And so our recommendations are really, if there is a difference between criteria or what we see in the criteria and how the system is functioning, that we might want to draw forth a recommendation that might help you in your strategic planning to just to make targeted improvements to the system. So in part 1, just a couple of the recommendations we've made are to clarify the roles and responsibilities of the DHHS partnerships, those being primarily IDA Part C office and ADSD, where we noted through conversation and through other observations that there are at times overlapping responsibilities that may cause some confusion, particularly out in the field with community partners when they might receive, for example, conflicting information from 2 different offices. And so here we just recommend that you clarify what those roles and responsibilities are. That might help to shore up some of that confusion. And then to explore other options for increasing funding from other sources, like I mentioned, through Medicaid or through the adoption of family cost participation plans as the system continues to grow and service demands will also continue to grow. In part 2, we discuss Nevada's workforce, and we do so in the context of 4 key disciplines. And we're basing our assessment of those disciplines on the proportion of hours that are authorized through IFSPs, where 90% of the IFSPs that we tested, and so that was really just a test month, but we were pretty sure that would hold true across other months. And I think that was July of 2023. So 90% of the IFSP hours were based on, excuse me, let me jump to that chart real quick. So here's the chart I'm referring to. So we focus this section on the 4 disciplines that you see here at the top. So special instruction delivered by developmental specialists, and then therapies delivered by speech language pathologists, occupational therapists, and physical therapists. So 90% of the IFSP time authorized in July 2023 was delivered by these 4 specialties. And so we acknowledge the importance of practitioners like audiology and nutrition specialists and so forth. But we wanted to kind of, to use a Stephen term, major in the majors and really focus on those disciplines that are providing most of the lion's share of the services in the state. And so throughout this section, you'll see discussion around each of these disciplines, starting with developmental specialists. And so developmental specialists deliver special instruction. And in the section, we describe kind of what their major responsibilities are. We draw a comparison of the developmental specialist qualification requirements in Nevada to other states across the country. You'll see these states kind of appear a few times. I think there's 7 of them. So Arizona, California, Colorado, Georgia, New Mexico, Oregon, and Utah. These are states that we interviewed or tried to interview their Part C coordinators to understand a lot about their system, including things about their qualification requirements for their staffing. Again, to generate ideas about maybe what Nevada could consider if you were to make changes to your personnel qualification requirements. So one of our findings related to developmental specialists was that Nevada's requirements, including its endorsement requirement, tended to be a higher threshold to reach than comparative states, but that the Part C manual, for example, could be clarified or even updated to provide a clearer pathway for like paraprofessionals that might be on their way to achieving the college degree requirement and the endorsement requirement, but have not yet gotten there. And so these are ideas, again, that come from other states and that are allowable under Part C, though we acknowledge that there are some statutes in the state that may limit your ability to just kind of, shift over to a paraprofessional service delivery system. That's not our recommendation. Throughout this section, we also describe key differences in wage levels between services that are delivered by ADSD and services that are delivered by community partners. And so, for example, here we're pointing out that the average wage level that we measured through our data analysis from state facilitated developmental specialists was about $30.54 per hour, compared to community partners who paid their development specialists an average of $22.97 per hour. We also would point out that we're measuring at a time when the rate was recently updated, and so there might be changes to these rates, but that these structural discrepancies in pay and also caseloads for development specialists make kind of a discrepant system. So later when we talk about recommendations, one of the recommendations is to kind of monitor these differences across the ADSD facilitated services and community partnership services so that discrepancies or disparities like this don't persist. And we do a similar kind of a set of analysis for the therapies for the three major therapists that we referred to earlier. So we have a table here, for example, where we talk about the average wage levels measured from data that we obtained from the reliable contract. And this is the average wages by statewide and by each of the three major regions. And then we compare those wages to the same practitioner wages for community partners, and again find that state wages are they're fairly competitive and they're comparable to what we would pull out from the Bureau of Labor Statistics as average wage levels, but are much higher than community partners are paying. And again, that may be a factor of the rate that was in place at the time that these wages were measured. And so things may have changed since then, but we just want to again point out that these disparities kind of existed, and we want to find means and recommendations that will help to monitor these differences over time and make sure that they don't continue to persist into the future. The final component of this section discusses the comprehensive system of personnel development. The CSPD itself is a framework that is required of all systems to kind of integrate. It's a means that the Early Childhood Technical Assistance Center points to as the primary mechanism by which states ensure EI services are provided by knowledgeable, skilled, and competent individuals, and also the central forum for developing strategies for recruitment and retention. And so we recognize a lot of the good things that are happening in Nevada through its CSPD framework, such as the adoption of the alternative pathway to endorsement for development specialists. That was a recent advent that we acknowledged throughout the report. And then one of our recommendations, jump to our recommendations for this section, is to commit the CSPD to kind of a written document, like a strategic plan, that you can acknowledge some of the findings from the report. We also know that it's been a little bit of time since the analysis in the report was done, and things change pretty rapidly in the labor market. That the CSPD is more like a living document once drafted, and so you want to continuously reassess workforce-related challenges, and look for opportunities to borrow from other systems across the country and how they're approaching their CSPD plans. Arizona, for example, has a fairly comprehensive written plan that includes just all kinds of tools and resources, like interview questions that might be used for community partners or for ADSD in interviewing practitioners coming into the field, and other resources like options opportunities to obtain scholarships to go to college for practitioners that are maybe unable to kind of continue after an associate's degree, for example.
Eric, we have about 2 more minutes left. Can you run through that last section for us?
Yeah, sorry about that. I'll just kind of jump to, since we only have 2 minutes, I'm just going to jump to the very last sections, part 3 conclusion. So as I mentioned really briefly in part 3, this is more of a data intensive section. So you'll see an awful lot of data analysis and tables and charts and so forth that are comparing different outcomes and in different ways. And so we're looking for how service outcomes look at the regional level and how they look in comparison between ADSD facilitated and community partner facilitated services. And as data is available, we looked at how service outcomes look based on different demographic factors like race and ethnicity and the language status of the family of the child. And so in this section, we just have a couple conclusions and recommendations. So the first recommendation is to review and revise the IDA Part C manual and other policy guidance so it's more centrally accessible to all EIS programs and personnel. And that kind of stems from a finding that there's a feeling that it's sometimes hard to get to consistent guidance, and the Part C manual itself is more of a recitation of statutes and could be maybe more resourceful or used as a resource if it includes things like information about how the compliance reviews are conducted, for example. And then one other recommendation that we've made is to do what it's to continue doing what you're doing by leveraging data and other analysis, including maybe new data that might be presented in the new NEIDS system, and then leverage that analysis to develop strategies for monitoring, resolving any access disparities, some of which are noted throughout this report. So sorry I had to rush through that last part. I didn't do a very good job of keeping track of my time, but I'll stop here, and I don't know if there's time for questions or not, but appreciate the opportunity to present today.
Yeah, and thanks for that walkthrough. I know at our last meeting, we got a kind of a overview of some of the data, and now we have the full report, and that walkthrough is helpful. And I think the next step is for us to read through the report between now and our next meeting, really dig into it, and everyone bring back kind of your highlights and questions and ideas for taking some of the suggestions forward. So I really appreciate the work that you've all done with it. It's a super comprehensive report, and it's actually a good read. I'm going to be honest. Sometimes reports can be pretty lengthy, but it's pretty great to read. So everyone, you can spend your time with it. Any pressing questions for Stephen and Derek, kind of on what the layout of the report that help us understand it as we dig into it more? We'll get into content kind of in our next meeting, I think. Okay, great. Well, good homework for everyone. Move forward. Thank you so much, Stephen and Derek, for your time today. We really appreciate it.
Thank you.
And we'll be in touch on any next steps or maybe additional times for you to come and talk to us about it.
This next section is actually Fatima.
Oh, it's on Sarah?
Yeah.
Okay, we're going to move to our next agenda item, which is the update on the policy 27.2, which is not Sarah, it's Fatima. Where is she's unlike
Yes.
Yes. Good morning.
Hey, Fatima.
Do I have the right document up, Fatima?
Let me look here. Yes, you do.
Okay.
And I just have to say before I get started, I got to see a pan of the room, and Jalen, I love your suit. So I just had to comment on that. I'm Fatima Tate. Oh, go ahead.
I was just saying we need to put that comment in the minutes.
Yes, make sure that's noted.
With the picture.
That's one word for word though.
Yes, that's the verbatim one.
Yes.
Yes.
Sarah, you have your hand up.
Yes, also, this is Sarah Horseman for the record. We also wanted to note that it was not listed appropriately in the agenda. This item is not for possible action. It'll just be for information only for the council.
Great. Thank you, Sarah.
Thank you, Sarah. I'm Fatima Taylor for the record, and I'm program manager for NEIS for the Southern region. So today I'm going to walk you through the highlights of that policy. So I'm going to share with you kind of the process that we go through and then what the highlights for this particular policy are. So for our intake and eligibility policy, as we stated, it's 27.2, and that is in your packet. So when you have a moment for the light reading along with the system study, you can read through that policy. For any comments or feedback that you have on that policy, if I could have that within 1 business day, because we are moving forward to have it published, finalized and published by October 1st. So I make sure that I drop my email in the chat after the presentation today. So I want to walk through just briefly with you all with the policy development process of what we do. And so we have work groups, and those are where all the discussions, changes, and updates are made based on the input that we receive from a variety of the work groups. We try to make sure that we have representation statewide from our program so that all regions are represented. And then we have managers, supervisors, and direct line staff to ensure that it's comprehensive decisions and compliance is included where applicable. So we want to make sure that we have all our bases covered when we develop a policy. And then the standardization of that policy, looking at the existing materials and making sure that we're streamlining the processes across statewide. So our goal is really to create that consistency and quality of service delivery statewide. And then the last part of our process is public input, presentation and solicitation of stakeholder feedback as we're doing today. There's also a public workshop tomorrow. So that's part of that is our policy development process. I'll move down into the intake and eligibility policy and those revisions that were made. So when we pulled that policy out, we knew that there were some revisions that needed to be made as far as removing definitions of LIHTC and Track 4. These are electronic systems that we're no longer using. And that was section 27.2.2. We also revised the policy throughout to remove LIHTC and Track and replace with a more general description of designated electronic system of record. So that we wouldn't have to go in and change the policy every time we had a possible system change. We also revised the policy to provide clarity and streamline statewide processes and tools for screening programs. So for example, we updated and streamlined the process for the Child Abuse Prevention and Treatment Act, so our CAPTA, and those are sections 27.2.3A. 2 and 27.23.3.B.4. So for our screening and monitoring program, those sections were also updated, and those are 27.3.3.A4 and B5. Child find opportunity section was also updated, and that was in section 27.2.3.5B1. And then the senior physicians collaboration of the NICU screening purposes, section 27.2.3.B2 were updated. So those are the highlights of those policies of that policy that we've updated. Were there any questions? Okay.
So want to look through that? You want them to email you directly, Fatima, with
Yeah,
comments?
and I'll go ahead and put my email in the chat.
And you want those by the end of business day tomorrow?
Yes, please.
So, yeah. Any thoughts, end of business day tomorrow? Thanks for telling us what the major changes were. That's helpful. Okay. Any quick questions for Fatima? Great. So next, Sarah, this is our in-person and telehealth report and program updates and highlights. Anything you want to say about those? They are in our packets to review.
Just information.
Yeah, just information. Anything you want to say, Sarah?
Nope, Just, this is Sarah Horseman for the record, just that information is available in packets.
Okay, thank you. Okay, we're gonna move on to item 5, which is just an update on our subcommittees. This will be a very quick update. We just wanted to, at our last meeting, we were trying to get volunteers for these subcommittees. So I'm going to put it out there that we haven't received a lot of volunteers for these subcommittees to actually make them active yet. So if anyone is interested in participating in any of these subcommittees or work groups, or you're welcome to. The Child Find, Family Support, and Equity subcommittees are open to anyone. They must be chaired by a council member, but participation can be anyone. And then the new membership subcommittee and the bylaw committee, which we'll also talk about in strategic planning, those committees are limited to council members. But if you're interested in any of those, you can tell if you're right now, you can tell Mary and I today, but we'll also be sending out another interest survey as we did before, if you're interested. So that's all. Mary, anything else?
No, I did want to share, this is Mary Garrison for the record. I put the questions at the bottom so that you guys could see, because they did get cut off when I tried to show the data here. So you could see what those questions are to kind of gauge how many individuals we had for each of those. So yeah, we'll send out a new survey and see after the retreat if there's new interest in any of these.
Yes. Our goal is to get those subcommittees meeting in October. So, great. Okay, our next updates come from item 6 are the Part C office. Gloria, as my host. We have a lot of this information in our packet today, so Gloria will give us some highlights.
This is Mary Garrison for the record.
Yes.
I will start with the Project Assist report. I am extremely happy with the data that we are now able to get from the report. So we changed the log as of May 1st, 2024. We collected very minimal data previously. Now we're actually collecting enough data to give us information about why families are calling or why individuals are calling us, how many referrals are going to the programs and what programs those are going to, which is extremely helpful for us to provide resources in the areas that are needed in the state. So this overview of the report is listed here. I've already talked to Melissa. I would like to see us maybe take a look at this and see map-wise where those referrals are coming in from to help us a little more visually with what areas need those supports and information for Project Assist. But even in here, you could see we from May 1st, 2024 until the end of August, 136 referrals were sent to the EI system from our Project Assist line and email address, because we do receive those in both ways. 3 individuals requested community resources. 2 were regarding complaints or concerns. 1 individual was asking for EI job information. Katie Beckett was another thing we wanted to be able to track, because that's something that we struggle at times trying to provide the supports as a state for Katie Beckett, and people don't know where to go. And so they call us, and we only got 1 call. I'm actually surprised. And then 3 Part B. So as I said, I'm very happy. I think that this data will continue to show us more information that we need to make decisions in the Part C office, but also to give the council additional information to make decisions as well.
Yeah.
I will
say yay for data.
Yay for data.
And thanks, Melissa, for always for your data work. It's very appreciative. It gives us such really good information as a council, so we can
absolutely, yes. And then I'm opening up the complaint log now for everybody to see on the screen. And I will turn this over to Lori Ann and the others on the Part C team.
Okay, thank you.
I hope you can see that.
Thank you, Mary.
Okay.
Hope you all can see. Good morning, everyone. Lorianne Molina Lovell for the record. I'm the IDA Part C Coordinator, Clinical Program Planner 2. So happy to be here with all of you. Thank you to everyone for traveling near and far and through flights that were delayed and going through all the smoke that's coming over from the fires. Anyway, we're delighted that you're here. I apologize to those on the camera who may not be able to see me because I'm standing in front of the room of our council members here. But we wanted to give you updates about the complaints that have arose in our system. And we share this out quarterly with everyone. And within this last quarter, we have received one formal complaint from a program in the South, as you can see. And there are reported claims from a family regarding their services. And so we are actually conducting an investigation at this time. And we have Jennifer Kellogg, who is our liaison for this program here, if anyone has any questions. But our team is conducting interviews. They started that last week, and that should wrap up this week. We expect to have our complaint report completed within 60 days of the issued complaint. So that should be by middle of October. So the next time we see you, we should have an update for you regarding that complaint. We do have all of our liaisons here in the meeting. We have India Morgan, Jen Kellogg, Dr. Pam Silva, and we also have Dr. Lauren Roscoe online with us. So does anyone have any questions about this section of the meeting? Alrighty, it looks like we don't have any questions. Anyone online or anything in the chat? We take the complaints from families very, very seriously. We also will follow up and do intensive focused monitoring if needed, even for complaints or concerns that haven't risen to that level of a formal complaint, because dispute resolution is a federal regulation under IDEA. I believe we are okay to go into the next section, which I believe is Melissa's section. So good morning, Melissa.
Thank you. Good morning. Thank you, Lorianne. Mary, sorry, I almost forgot your name. We're the same person. I'm going to share. You should see the two of us together. So, sorry for the distraction. So the data systems for DAISY is for data systems within the IDEA, early childhood systems. They have lots of resources for parents, for providers, and for ICCs. Whether those are, they have state ICCs for every state and territory. Toolkits, guides, frameworks, all kinds of stuff in here. So daisycenter.org/resources is the place I'd like to point you. This is for your strategic planning and for all of our professional endeavors going forward so far as data. Inside the packet, we have included, I don't know how big it is on your screen, the target setting guide. We do need to look at our targets again for our APR. So the Part C and 619's target setting guide has been put into your packet today. It's on the introduction page. There's indicator specific guidance for these as well. It includes C and B for any of those federal indicators. So I wanted to point source because in the coming quarter, we need to look at our APR and we need to adjust some of our targets or not. That really is at the pleasure of the council. So I just wanted to give you these resources so that when we meet again in the next few months, that you've got your homework done. So apparently homework is the word of the day. Thank you.
Keyword.
You have the opportunity to learn.
Share my screen.
So the upcoming training.
Yep, VEC.
Does anyone have any questions for Melissa?
I just want to say thank you for sharing that resource. And I wrote a note too that I think moving forward, we should each meeting share some of these great resources that we have from IDA or our TA centers. And that's a great, Daisy's got so, and like really reader-friendly information. So I think that, thanks for sharing that, Melissa. I think we could continue to do that as we move forward.
Okay.
Yes, ma'am.
Thank you, Melissa, Lori, and Melina Level for the record again. We would like to discuss our Professional Development Center briefly with you. We want to thank everyone who chips in and lends a hand, from guest speakers to our volunteer instructors to our wonderful learners who are doing their best to make their way through the EI system. Joining us today is our PD Center Director, Maya Raimondi, who at one time was a developmental specialist herself. She's there in the back of the room, and we just want to acknowledge her. And in a moment, I'm going to ask Maya to share very briefly about her experience with the PD Center. We graduated 20 learners in April, and then 20 just last month, for a total of 40 learners. Another 20 are expected to graduate next April, and open enrollment, which is like a cohort 4, just began this week with another 20 learners expected to graduate next fall. So we're very grateful for this alternative option for learners to be able to fulfill their position requirements and maintain their positions, which ultimately improves results for families because of the continuity of services for these families. The PD work group will be traveling to the Division for Early Childhood International Conference next week in New Orleans. And please think about us. We heard that there might be some hurricane weather happening there. So we're hoping for good weather, that the weather will improve. And we're very honored because we were selected. Our proposal to present about this Grow Your Own initiative was accepted, and we will be presenting in 2 ways next week, through a poster session Tuesday evening, and then hi, good morning.
Good morning, Mr. Mother.
Okay, hi, Jeff. And then an in-person session for an hour next week, Thursday morning. There's a lot of exciting activities happening with the PD Center, in addition to what we are providing for developmental specialists. So there is on the screen that I think someone was showing the flyer that was developed by Dr. Lauren Roscoe, who has become a whiz at Canva. And we are extending our professional development opportunities to families too. And that was our goal. We wanted to provide opportunities, not just for developmental specialists, but also for therapists, any EI provider, to stakeholders for the ICC. We're coming for you guys. We're going to develop a training hopefully in the next year for everyone. And then ultimately for families. So we have a couple of trainings. We have a feeding one coming up this month. And then this one is going to be in a collaboration with our colleagues and friends from ATAP, the Autism Treatment Assistance Program, who are very honored, are willing to give up their time to help families to understand what autism is, what services and supports and resources are available for them, so that families can be empowered and ultimately improve their results for their young children and their families. So we encourage anyone, if you have contact with families, to please assist us in distributing this flyer. We have requested to all program managers to share this with their IFSP teams, who would then ultimately share this with their families. And that's a little bit of a wrap up for me, but I would like to provide Maya an opportunity to share out because she is our PD Center Director and has really lifted the load for myself, our team, and our PD work group in being our lead instructor and curriculum developer. Good morning, Maya.
Hello, sorry. I'm Maya. It's been a wonderful opportunity to be a part of the PD Center. It's been great to see the success and hear the personal stories and feedback from all the development specialists who thanked us for this opportunity, even send personal notes saying that they're able to stay in early intervention where they would possibly had to have left in the past because they were unable to go back to school and afford the education for that endorsement. So it's been very rewarding and wonderful watching the capstones. You guys are always welcome to come when we have our capstone presentation. We have so much talent within the EI community. And it's very exciting now to kind of be going into a new phase as well with offering these trainings for families and including families within the EI community. The one that we have coming up first is a feeding training, and we already have, I think we have 70 people have signed up for this. So yes, so we are really excited, and hopefully there is a need and desire for families to even get involved and get education. So we're very excited about that. Thank you.
Thank you, Maya. And before we close up this side, we want to thank Robin Kincaid from Nevada PEP, who has partnered with us. She was a guest speaker for one of our courses, and we appreciate that collaboration. And then we also have been able to share at a national level with Robin for the DEC's Community of Practice on Professional Development. And lastly, we want to thank all of the families out there who have been supporting us and also joining us for PD. We have had several families over every cohort attend our families class, which is our second of our 6 classes. It's DS Series Course 1.2, partnering with families in early intervention. And we have families that come in as guest speakers. And we really want to give a shout out to Sarah Sills from NEIS Reno. She is the one who started the development for that class along with others in the PD work group. And she made sure that at the end of every course, there were families coming in and sharing their stories. And we have, even though Sarah is no longer the instructor for that course, we continue that tradition and see that as an essential part of our curriculum and a huge reason of the success that we share broadly with everyone. So thank you for the updates, for attentiveness to the updates on our PD Center and professional development. There may be more to share out about professional development in our system with the quality assurance team. They do a great job as well. Abby Chalupnik and her team provide many trainings. And so we will be collaborating with them over the next year to ensure our training schedules support each other and we have a nice, rich variety of options for our system. Does anyone have any questions on professional development? Well, if anyone is interested, please join us for our work group meetings. We meet once a month and we would love to have you. Or if you're not able to join, let us know if you'd like us to email you any materials. And if you want to evaluate those, we would love feedback as well. Right, well, we look forward to sharing more updates about PD in the next quarterly meeting. And I believe we can move on to the next.
Thanks for the swag, PD Center.
Yes, we have some swag, and sorry for those who are online and didn't get the swag, but we do have some swag for everyone here in the room. And these were paid for by Governor Finance Office, GFO funding that were leftover ARP funds. And so we're very grateful for these. They also serve nicely as a Childline outreach. Icebreaker to talk about early intervention in the workforce.
I immediately needed a Band-Aid this morning, so.
Oh, okay. Well, thank you so much for Dr. Pam Silva for toting all of those over here from Carson.
Yes, thank you.
Thank you. Okay.
So the next thing is Medicaid recruitment.
Oh, yes. So this question came to us, I believe it was in April from the ICC, and I am not the most qualified person to talk about this, so I can simply state what was discussed. I know that ADSD does a great job with collaborating with DHCPAP, the Division of Healthcare Finance Policy, who they have their Medicaid unit there. So in your information only notes are information that was already shared at the last meeting, but we wanted to make sure it was made available to you. So there's information about communication with ADSD and DHCPAP, really exploring how we can streamline our NEIDS processes for prior authorization so that we can obtain as much Medicaid revenue as possible. So that's there for your information. And if anyone has any questions, please let us know. But we just wanted to honor that request that was made to the ICC. Yes, please. Yes.
This is Rique Robb, Deputy Administrator for Aging and Disability Services. And to add to that piece of it, I am not exactly sure what the request was, but I'm assuming part of that is that we actually changed the PAR process for early intervention providers so that some of those pieces do not have to go through that request to be able to streamline that in a more efficient way. And also all the other programs that provide similar services did not have an actual prior authorization. So we were able to streamline that for our fee for service, managed care, or sorry, Sarah, is it fee for service or managed care? Sorry, I'm not the subject matter expert on this either.
Fee for service.
I did have it right. I like it when I actually get it. For fee for service, the MCOs at this point have the option of being able to allow that, but at this point in time, we have not been able to get into those conversations to try and streamline the process as well. So it has, I can tell you, it has been a 7-year process for us to get that. Shannon Sprout and I started that when she was still at HICFAP. So we were very excited and did lots of dances when we actually got.
Thank you very much, Ricky. Mary would like to add.
I just want to also share, this is Mary Garrison for the record. Thank you, Ricky. I did reach out to HICFAP about reporting. So in the coming meetings, we will have them, they sent me a report. They weren't able to fully attend today and be here to participate. And I don't know that any of us truly qualified to look at what was in that report. I looked at it, I'm like, I don't know. So they'll come in, they'll talk with the council. We can brainstorm and see how we can assist.
And again, this is Rique Robb for the record. It just ensuring that we have some of those questions too from all of the membership is to ask the questions so that they can come prepared.
Thank you.
But they are very open to being here and explaining any challenges. We certainly have worked through the needs process, but this is one piece again that we've been trying to do here. So in a year from now, I think it's going to look different. It's just going to take us a bit to get there.
Thank you, Ricky. Thank you, Mary.
Thank you.
Yes.
More homework.
Yeah, so that question came, I believe it came from Robin, our council member. And it was a simple question of what can we do to increase our Medicaid funding for early intervention? So thank you to everyone who's working really hard on increasing that funding. We're hoping that will continue to be streamlined, as Ricky stated, throughout this year. And I apologize if I forgot to say my name, Lorianne Molina Level, for the record. Okay.
The next is needs assistance.
Yes. Does anyone have any questions before we move on to our annual determination?
We have about
I want
6
10 minutes. Yeah.
Okay.
10 minutes.
Okay,
No, actually, yeah. Like
Well-
if we could do 6 minutes, let's do it.
I can do 2.
So this is the APR.
Yes, so here on the screen before you is the annual performance report, state performance plan, or APR, that is what we call it for short. This is our annual report, which is submitted to the United States Department of Education, Office of Special Education Programs, OSEP, on behalf of the ICC. And so the ICC certifies this, the co-chair will certify this annually, and the ICC will usually convene in January and do a review and provide an approval, a consensus for approval. You'll see the indicators that are listed throughout, which are required for all Part C states and territories to report on to receive their funding. And the result of our performance report this year was a needs assistance determination, which we received in June. And the assistance that we are receiving is from OSEP and their funded TA, or technical assistance centers, at the national level. So we continue to meet with our OSEP technical assistance lead monthly. We met with our OSEP leads in August at the OSEP Leadership Conference. Other forms of technical assistance that we receive and are encouraged to take advantage of as we continue to build our system includes TA centers such as the Center for IDEA Fiscal Reporting, CIFER, the DAISY system, which Melissa just reported about, the Early Childhood Technical Assistance Center, and also the Early Childhood Intervention Personnel Development Center for Equity. That one is a little bit of a mouthful, but I hope I got that one. They were formerly the Early Childhood Personnel Center, ECPC. So we enjoy receiving technical assistance from these leaders in early intervention. We are learning a great deal, and we are still awaiting technical assistance that will come in the form of a differentiated monitoring services and supports report from OSIP. That DMS report is still pending. We did undergo our monitoring at the federal level back in November, and many of you participated in that, and we're very grateful for that whole system perspective. Nonetheless, we have heard from some of our colleagues at recent conferences that they too are waiting on their reports. OSIP had advised us they projected a 120-day turnaround time, however, from November to now, and we are still waiting. They did let us know that in August when we met with them at the OSIP Leadership Conference, that the report is under review. We also heard informally from some of our fellow states that it can take up to a year for some of those reports. So we will keep everyone notified. We are staying in close contact and collaboration with ADSD and with our ICC to share about the results of that report.
And I just wanted to share that with this, I did include a handout, which I had up on the screen. And then this is the link that's at the top, that website. So this just talks about OSIP's monitoring and state improvement planning, their division, and then the technical center, which I just had up here. This has some information in here as well. So this is how they assist us through that needs assistance.
Even though we received that determination, we don't want to discount the hard work occurring by our diligent workforce and all of our early intervention programs. There are just many hurdles to still overcome for families as they continue to go through moments and periods of potential delayed services due to critical workforce shortage. And so I'd like to discuss that in just a moment. But before we go into delayed services, tools for family engagement, does anyone have questions on this annual performance report, annual determination?
This is Melissa Sladen from the Part C office. I wanted to include the Center for Idea Fiscal Reporting, CIPHER. We received TA from them as well. And the APR report that we turned in this year, submitted this year, will also be a very helpful tool for setting our targets going forward. So please do review that APR. Thank you.
Thanks, Melissa. I did mention, you might not have been able to hear me, I apologize. I did mention CIPHER, and we actually had the opportunity to present at the national level with CIPHER last year. So we maintain close contact with our CIPHER TA leads, and look forward to learning more from our national advisors. Any other questions or comments about annual determination? All right, let's move on to this next section briefly. So because of the delayed services that are occurring, and they're not occurring across every program, and they do not occur consistently. There are times when their workforce shortages occur because of turnover, and therapists are leaving one program and then being hired at another. During those moments, our office has advised the system to maintain openness and transparency with families. Dispute resolution is always an option for families, but we find that families are the ones that are complaining are really the ones who are feeling left out and isolated, uninformed, and not included in their services. And also a huge reason to communicate with families is to decrease their stress. They need to understand what to expect. They need to understand what their options are as they go through this very vulnerable time in their lives. One way to support families is to have that consistent information being shared across an entire program, where not just some families receive a good discussion and documented services or documented discussion on wait periods, but that every family receives the same information so that there's an equitable level of communication for all families. This is just one example of a family engagement tool that is going out to families by some programs. This is just an example of, say, speech services, what could be sent out during a program's very proactive stance on attempting to hire for speech therapists and what families can expect in the interim. I want to thank the programs who helped to develop this tool, and it still continues to undergo iterations. This was created by state and community programs, and they continue to revise it, and they send in their communications for our review. So we want to make sure that we acknowledge them. As you can see, the letter is very clear, very transparent. of what is occurring for the families, that there may be a delay due to workforce shortage. And these are things that can be expected. Compensatory services, there may be resources that are needed in the community, and the program will continue to follow up, and that the program takes this very seriously and is addressing this swiftly. And so thank you very much to all of the EI programs who are providing this. Although it is not an IDEA requirement, it falls in the realm of best practices for communication and teaming with families. Does anyone have any questions about the family engagement tool? And we just received a request from Texas yesterday. They heard me speak about this at our conference last month for the data conference, and they asked for the letter and for samples of the scripts that are going out to ensure equitable communication delivery. Okay.
I was just saying
Go ahead.
for the family outcome survey, I'd like to move it to the next
Yes.
meeting because I would like us to spend a lot of time on it.
Absolutely.
So, okay.
And Jenna, I agree with you. This is Mary Garrison for the record. Melissa did a great job of compiling this for us for this meeting. I think this can be utilized as you start looking at your strategic planning, that feedback that we're receiving from families. But Melissa will go in depth with the results of this during the next call.
Thank you.
I think it'll be a little late for that. So I would like to point out that in the packet, not all of the results of the questions were included. I don't know what happened there. I created another Excel spreadsheet, emailed it to Mary at the beginning of the meeting. I would like you all to receive that material today. It's just the Excel spreadsheet. It includes the results of each question, indicates which questions affect our indicators, and includes the de-identified comments as well as demographic information. I will tell you that our percent has come up of responses. It has not reached the 20% that we had the one time a few years ago. It did come up like a percentage point this year. We did receive a few more of those, but when looking at these, we did not meet the target in any of the family outcome survey areas. So you can see those data in the spreadsheet that Mary will get to you today. Thank you. Sorry, Dr. Jenna, I know that you wanted to skip it, but that's the base information I needed to share.
Yeah, overview is great, but I think at our next meeting, I'd like to spend a large portion of time just talking about the results. So, absolutely.
Okay, well, thank you very much for your time. Again, this is Lorianne Molina Level. Please let us know if you have any questions. It is an honor and privilege to serve the state of Nevada, and we look forward to the remainder of meetings and retreat strategic planning occurring today and tomorrow, especially with our colleagues from Social Entrepreneurs Incorporated. So thank you very much.
Yeah. So this brings us to item 7, which is public comments. I'll open up again for any public comment. I will start with those online. Is there any additional public comment on the quarterly meeting items? Hearing none. Anyone in the room? Yes, Robin.
This is Robin Kincaid. I just had a quick question. Are we going to have an opportunity after public comment to talk about future agenda items? I'd like to make sure that gets on the record.
Yeah. Yes. Yeah.
So you'll call for that?
I will call for that.
When we close the
Yep.
meeting.
Okay, yeah, just wanted to verify that. Okay, thank you.
Any other public comment? Okay, I'll move to item 8, which is about our next quarterly meeting. So I'm going to start with agenda items.
Yes.
And then we'll look at dates real quick so that we can keep on our time here today. So I have some items. I'll list what I have already is to 1, discuss in detail the systems report, the family outcomes survey, bringing questions about Medicaid into Medicaid. I'm saying Medicaid. We will share another data resource, our regular items. And now I'll open up to council members for additional items that you can think of now. You also can send us you can email me and Mary additional items in between meetings if you think of them. But Robin, do you have an item you'd like to make sure?
Yes, this is Robin Kincaid. So this is a kind of a list that I started back in January.
Yeah.
So the yellow bar report, having it as a standing item, is it in the packet somewhere? Maybe I should ask that question.
It's not today. It's not.
I
today.
searched several times.
No, it's not, and it's, Melissa might want to tell you why that has not been available.
We can just make sure.
Yeah, well,
We know why.
if the data system is,
If it allows.
Yeah.
Then it is.
Okay, well, the data, it doesn't have to be in the yellow.
The data,
bar.
yeah.
I don't mean, that's just what we call it. If you have a different name for it, that's great. Okay, a meeting to revisit the SPP APR targets, and maybe that's what you already said, but I don't recall getting any kind of a date, so maybe we can talk about that. Okay, there was a closing community programs process. Is that process in the packet, or when will I be able to see that?
that was in the April meeting.
It wasn't
In the minutes, you'll see it in there.
Thought it
They
was,
talked
there was
about
nothing
it, but
still
we can-
not quite finished with that.
Okay.
Okay, let's see. Revising the Part C manual, the parent manual. I don't know if there's a date set up to do that. But it definitely needs it. And, okay, we do get some, are we getting actual data on how many are waiting? We have a little bit of that, right? A little bit of data on that.
The delayed
For
service
services?
report.
Yeah. Okay. The thing that kind of brought up with the Medicaid is that I think it'd be very helpful for some of the new staff to make sure they're really familiar about the EPSDT. I know, Ricky, you're familiar with that. But we need to teach families so much about that. So I don't know if there's a way of having someone present or, provide some additional knowledge on EPSDT. I mean, you truly would be giving them a gift if you can help them understand. I realize that the state's not going to go through that process. They've been able to figure out another way around it. But to kind of reduce or eliminate prior authorizations for services, fee for services for Medicaid. Okay.
That's part of the coordination with the
I just wanted, I didn't hear that today, so
No,
I appreciate that. Okay, all right. And then we're going to continue to get data on Project Assist.
Yes.
Yeah.
Okay,
That'll be regular.
I just wanted to verify that. That's it for me. Thank you.
Okay, thank you.
Thank you.
Other items from council members that you want to tell me now? You're always welcome to suggest items to the agenda for the quarterly meetings. I will just say sometimes the items too, we may put out to work groups or subcommittees if it's more appropriate for them to address them and then report on them at the quarterly meetings. So, okay, Mary, do you want to look at dates?
Yeah, we can look at it. I do.
There is something on my calendar already.
We already have something on the calendar. And this was based on the survey that was sent previously. And it was related to the strategic planning and the continuation of that, I believe. And where we're looking at December. So the date I have is December 11th.
No, I have December.
I have December 3rd.
I have December 3rd on my calendar.
I have December 3rd too. I have this whole week
Okay.
as a possible, let me remove this off my calendar because I don't even know what it is.
Okay.
Well, it's there, but it's ICC strategic planning. I'm gonna cancel that. That was the 11th again. So I have the 3rd from 1 to 4:30 p.m. in December. We can either, well, I think are we gonna be doing any strategic planning at that point? So
No,
that
let's
is
just
the quarter.
plan our quarterly.
That's our quarterly meeting.
So does December 3rd from 1 to 3, I have 1 to 4 on my calendar. Starting at 1 o'clock, work for council members for our next quarterly meeting.
Okay.
Online.
IFC was on December 12th. That's why. What's this? Let's see what online says. Rhonda Lawrence. Thank you, Rhonda. She has to leave.
Does that, just so December 3rd, 1 PM, next quarterly meeting. Melissa?
We'll need a January meeting to approve the APR. That
Yes.
can or doesn't have to be a
Just
true
so you
quarterly
know,
meeting. It's just the APR if you want.
that December meeting is actually your meeting that would typically be in October.
Yeah, we're off.
Yeah, we're off on our time. So then we will go back to January as well for that approval.
We have plenty of things to talk about.
Yeah.
At any meeting. So, okay, great. We'll send that out. And we finished our agenda, so we can, what? Yeah, we can adjourn at 9:57. So thanks everyone for joining online. I really appreciate it. Thanks for everyone in the room. Also appreciate it. We're gonna take a 5-minute break if you're staying for the strategic planning meeting. And I'm gonna turn over facilitation. So take a few minutes to walk around. The restroom is across the way. There's also a water filler over there as well. Take a breath, maybe not go outside today, but. Thanks, everyone.
Thank you.
Thank you.
How are you?
I'm good. How are you, Rick?
We might be able to stand up. Okay, did we have
not a house yet.
No, I don't think it will be. Okay, we didn't figure out Wi-Fi though.
And we're gonna have to swap the room a little bit, so it's a little more immediate. I mean, that's just my thought. We're gonna have, we need to call Sarah in because her flight's now delayed. So we will have that. I think that's like maybe you. That's what I was thinking. Sure, if we just. It will be.
This is not a section.
I think we should be good.
It is.
Yeah, somebody. But you have to.
Probably for that staff. Yes.
But can you use my computer?
Probably. I mean, like I have my phone to kind of follow along with.
Yeah, I think we
It
hang this up. Or
doesn't make things impossible. Just.
doesn't